Continue. फिर से करना है. Audibility is not there. It's okay. So should I start? For the participants' benefit, yeah. So I think there was some issue. So I think on the online participants have not been able to hear properly. So apologies for that. Okay. Once again, a very good morning to all of you, and I wish you all a happy World Mental Health Day 2024. Our esteemed chief guest, Professor Urmi Nanda Biswas, is here. She'll be talking about the topic. It's okay. Continue, sir. We'll be talking about prioritizing mental health and well-being and creating sustainable workplaces. So let me introduce our speaker first here. Professor Urmi Nanda Biswas is a professor in the Department of Psychology, University of Delhi. She is an applied social psychologist focusing on health, gender, and workplace behavior. She has over 28 years of postgraduate teaching and research experience. Before joining Delhi University, Dr. Biswas worked as a professor and head of the department at the MS University of Baroda and Ahmedabad University, Gujarat. She has been a visiting professor at Gothenburg University, Sweden, and a senior research fellow at Roehampton University, London. She has completed various international collaborative projects with grants from Commonwealth Secretariat UK, Population Council New York, British Council UK, Forte Sweden, and Sastry Indo-Canadian Institute, and several other funded national research projects. Dr. Biswas has consistently worked on mental health issues across different populations. Her book on understanding attractive work in a globalized world discusses the importance of organizational values like opportunity for work-life balance and gender equality for productive and effective employees and their well-being. She has extensively explored the effect of workplace stress, work environment across different sectors, IT, manufacturing, education, health, and elder care in cross-cultural settings to assess its impact on the well-being and mental health of employees. Recently, she has also received funding to work on the mental health issues of the students of the Delhi University. Okay. So with this, I welcome Professor Urmi Nanda Biswas to this gathering here to our university. And I request our director, Professor Suhas, to welcome our chief guest with a potted plant and a shawl, please. Thank you. And I request director to please share her welcome address.
Thank you so much, Professor Swati Patra, respected chief guest for today, and also resource person, Professor Urmi Nanda Biswas, Professor Swati Patra, and my colleagues from Discipline of Psychology, directors of different schools, divisions, and units and centers of IGNOU, as well as the regional center directors that are, participating in this program via online. My faculty and staff from School of Social Sciences and also other schools and divisions of IGNOU, students and dear participants present here as well as online. Well, in India, the work of mental health professional or a psychologist is very complex and challenging. And this is mainly because of the diverse perception that people have about mental illness, about mental health. On one hand, you will have people who believe that mental illness is due to bhoot bada, or some people are in denial, absolutely denial. They feel even after diagnosis, they are either in denial or they feel it is not really because of mental illness. And, as I was working as a counselor and one of the, client whose child was diagnosed with a mental illness, who came to me and she said, no, probably this is because of bhoot bada, something like that. So they prefer bhoot bada to mental illness, as if there is solution to bhoot bada, but probably there is no solution to mental illness. There are others who probably even seek fake certificates, for learning disability or other reasons like legal issues and so on. There are also people who are probably they lack awareness about their own mental status. So there is a lot of involuntary kind of behavior they will express when you kind of approach them or when you want them to seek help. So these are the different types of people. There are also people who see mental illness in such a complex manner. And I would recall yet another experience where a few years back, one student came to me, a prospective student rather, and he asked all the information about our MA psychology program. And at the end, he asked me, ma'am, I have depression. Can I do this program? I said, would you have asked me this question if you had diabetes? He said, no. And he joined the program and he did it well. So these are the varied, diverse population that we deal with. And that is the reason why creating awareness about mental health is extremely important, about psychological issues and mental illnesses, because that is going to help normalize mental health and also reduce stigma. And this is also important for early diagnosis, because many a times we do talk about stress, and often stress is important, but then stress can also be managed very easily. But then when stress is not managed effectively, then it can develop into different psychological issues or major psychological disorders, even something like depression. So I think normalizing mental health and creating awareness is very important. And I really appreciate a discipline of psychology, my own discipline from School of Social Sciences, because over the 14 years of this discipline, the discipline was, kind of formed in 2010. And since then, we have been regularly organizing or celebrating Mental Health Day with main purpose of creating awareness. So I think that today's talk as well is very relevant. The title is Prioritizing Mental Health and Well-being, Creating Sustainable Workplace. And we also, on behalf of School of Social Sciences, IGNOU, I welcome you, Professor Urmi, and thank you so much for taking out time from your busy schedule and being over here. This is her first visit to IGNOU, though we have been friends and we have interacted in many conferences since many years now. But this is her first visit to IGNOU, and I think definitely not the last. Definitely not the last. And I welcome each one of you present here and present virtually for attending this program. Thank you so much.
Thank you, Professor Suhas. In fact, Professor Urmi had been
Yeah,
associated with
yes.
IGNOU online. Okay, now physically she has come to the university, so we are really happy about this. Now, before proceeding with the lecture by our chief guest, Professor Urmi Nanda Biswas, let me inform that the discipline had planned various activities on this occasion of Mental Health Day. The today's talk is one of them. By Professor Biswas on prioritizing mental health and well-being, creating sustainable workplaces. Next, we have a webinar on 15th of October in which Professor Ashish Pandey from IIT Mumbai will be delivering the third lecture on Indian traditional wisdom and workplace happiness. This is as part of our mental health lecture series under well-being, inclusion, and sustainability. So I would take this occasion to invite all of you to the webinar also on 15th of October. And also various activities related to mental health are being taken up by the regional centers all over India as part of this celebration of the Mental Health Day. And the discipline is also planning an e-magazine related to mental health aspects that will be taking out soon. So the discipline has always strived to create mental health and awareness and highlight different aspects related to this. We also have started an initiative in our school, School of Social Sciences, that is called as Aao Baat Kare. So that offers a platform for the participants to share different things and interact and discuss various things around the topic mental health and well-being. In the last 4 sessions that we have organized till now, the aspects related to self-awareness, communication skills, and other aspects have been discussed and deliberated through interactive activities and games also. Okay. As Professor Suhas was also talking about, mental health is not for a few only. It is for all. Because mental health matters for all and it is a universal human right and it is everyone's. And it applies not only in our personal life, but also our professional life. So, so that is why we all need to focus on this mental health, how it can be promoted, how it can be protected, promoted, and nurtured in all the aspects of our life. So with this, now I invite Professor Biswas to kindly deliver the talk on prioritizing mental health and well-being, creating sustainable workplaces.
Thank you very much, Professor Patra. Very good morning to all of you present offline and online. Honorable Vice Chancellor, Professor Uma Kanjilal, ma'am, in her absence here. Director, School of Social Sciences, Professor Suhas Setkover. Head of the Department, Psychology, Professor Swati Patra. Directors, heads from different schools and divisions and centers. Faculty members from different disciplines and research scholars, students, and all present here online and offline. I'm very excited to talk about this topic. When Professor Patra gave me the topic, I was almost, I said that, oh, what an opportunity to talk about workplace, mental health at workplace. It has always been very close to heart. And before going further, I must wish you a very happy Mental Health Day 2024 and all of you a very happy workplace all over the year, this year and hence forward. Talking about mental health at workplace. That's great. Why WHO is so much concerned about prioritizing mental health and well-being at workplace. When WHO just was wondering about it or had already decided about the topic, came the case, sad case of Anna Sebastian. All of you know, have heard a lot about Anna Sebastian Pereira's case. She was a 26-year-old Ernst & Young employee. I have picked up these paragraphs from her mother's mail to the director of, or Ernst & Young. And these two paragraphs I have picked up with an intention to show you what she writes. Anna confided in us about the overwhelming workload, especially the additional tasks assigned verbally. Each word is important. Task assigned verbally beyond the official work. I would tell her not to take such tasks, but the sorry for that. But the managers were relentless. She worked late into the night. Manager once called her at night with a task that needed to be completed by the next morning. And when she voiced her concern, she was met with the dismissive response, "You can work at night. That is what we all do." Burdening newcomers. So we noted two things here: work overload, task assigned verbally outside the official role assigned to the people. Second paragraph that I have picked up, it says, burdening newcomers with such backbreaking work, making them work day and night, even on Sundays, has no justification whatsoever. She had just left her hometown and loved ones. Everything was new to her, the organization, the place, the language, and she was trying very hard to adjust. Now it starts. You should show some consideration to new employees. Instead, the management took full advantage of the fact that she was new and overwhelmed her with both assigned and unassigned work. One sentence I have missed here, which I had noted. It says that most of these organizations these days do not do an induction training to the newcomers. I will add my son's case to this, who joined recently Deloitte. He worked there for almost 8 months. He was working for three, they have USA team, Singapore team, and UK team, 3 teams. And he was working 16 hours a day. A person below 30 sitting for 16 hours on the laptop. So we said, nothing doing, you change your job. Because if you look at the problems of Gen Z and before that, they have several types of physical problems as well as mental health problems, which is overwhelming Indian society now. So with this, so we noted with these 3 things that we keep in mind till the throughout the presentation, we'll move forward. This is something I picked up from the LinkedIn post. So this was with response to Anna Sebastian's case. This is from Kirti Arneja, Senior Associate Director, Emeritus, is a company which is into educational, educational sector and promoting higher education and all those things. And it had 11,690 likes, 100 and some reposts and things like that. So she, said that her company was so considerate that when she wanted to come back early from her maternity leave, the company CEO said no. She said that in my extra time I can work. The company CEO said no. And then the CEO said that your mental well-being is most important to us. So you should not be in a hurry to come back. And she said that in the when there are companies like Ernst and Young, there are companies like ours, and there are CEOs like ours and colleagues like ours who are considerate. And that was echoed by many other people in the LinkedIn. Somebody from Swiggy also said that he had met with an accident, and that post also said the same thing, how he wanted to come back, although he had not recovered fully, and how they said that no, he can wait and things like that. So we see both sides. There are some companies which are sensitive to the kind of mental and physical health conditions of the employees, and there are companies which are very kind of aggressive about the workload. So when I say that, when I talked about the unassigned workload, there is a concept. This is, I'll come to this a little later. There is a concept given by Bonn University, Germany, and the professor's name is Norbert Semmer. He talks about a concept that is known as illegitimate task. So he says that illegitimate task he defines as unnecessary task and unreasonable task. Unnecessary task and unreasonable task. And both of them create stress to the self. When we talk about unnecessary tasks, if you look at each one of us, look at our daily routine, we work for 8 hours at the workplace. I mean, we should be 8 hours, but so when it is a 5 days week. So if you look at how many things you are doing, which are unnecessary, which you can avoid, I mean, it doesn't, it is not productive. So how much time we spend on that? And does it contribute to your productivity? Maybe no. And then the thing is unnecessary and unreasonable. So something that can be done if the pot that can be carried by somebody who is a support staff, why suppose supposedly madam, it is a hypothetical case, suppose ma'am asks ma'am to bring it to the desk, it is unreasonable task. She has expertise, she has competence, which can be utilized in some other ways. But something which can be done by somebody else, that it's unreasonable for your competence and your skills. So these two things affects our self-identity, our identity as such, and creates stress for employees. So illegitimate task leads to burnout. So you read the glimpse of that in the letter that Anna Sebastian's mother has written to the director, that why she was asked to do these things. And many times they are asked to do it verbally. Why verbally? If the thing is official, it has to be a written thing or a professionally assigned task. A verbal thing is not recorded and not accounted for. But for the youngsters, it creates a lot of stress. Okay. So this I have taken from, if you go to the WHO website, they have published a series of documents, very well-researched documents on how mental health is being affected by, at workplace. And you see that these are the numbers they talk about, that how much suicide, how much depression, how many are suffering from anxiety, and what is kind of how it is affecting the workplace, people who are workforce rather. And that's why it is high time that we take note of it and we work on it. So decent work. I am sure there are economists sitting here and online who know that it has been the argument always that decent work is good for mental health. A decent pay, a decent working environment, it contributes to health, mental health well. One thing that not only the economists, but psychologists, sociologists, and all of us, all social scientists, it has been repeatedly discovered over the years that poor working environments leads to discrimination and inequality, excessive workloads, low job control, job insecurity, and thus a risk to mental health. Resource scarcity always leads to unhealthy competition and also harassment and exploitation. So if the work environment is not good, if the resources are not equitably distributed, then there will be exploitation, manipulation, and discrimination at the workplace, which will lead to, which will affect the mental health of people. And this is a recent report, but it says that it was earlier, estimated that there will be 15% of the people who will be suffering from mental health. Suffering from mental health is not important, but the whole challenge is that preventing the disorder to happen, to identify, to screen that somebody is going through a mental health issue and to provide support. Okay, so there has to be, if you look at, we say that 12 billion working days are lost every year to depression and anxiety. And coming here, I'll bring to your notice a very nice concept which is being, which has started, discovered 2 decades back, but it is picking up in the organizational framework and by psychologists, the concept of presenteeism. So we talk about absenteeism. Absenteeism is widely recognized, but what about presenteeism? We'll talk about that a little later. And that's how we lose a lot of money because of when the people are physically present, but not well physically or mentally. So the productivity is affected, the output is affected, the the man hours that we should be investing in the organization is affected. So that is why it is so important that we should prevent mental health risks at work. Okay, so this is what we are going to talk about. How important is psychological safety climate for making the workplace mental health pro. Presenteeism, screening mental health, and how important is mentoring and coaching. Anna Sebastian's mother said that there was no induction training for the newcomers. The girl was new to the place in Mumbai from Kerala, away from home and with, so no socialization, no induction training, no exposure to the organization culture. And that is the situation this youngster felt so much stressed and, devastated with the heavy workload to have the, what happened to her later on. So that says that how important mentoring and coaching is for the, the employees, young employees, and also the induction training when new people, freshers join the organization. Even in educational institutions, we don't have, I have been very fortunate to be a part of some departments where the education department does the induction training for newly recruited teachers in the university, but not that all universities do that. So it is so important to, tell them the processes, tell them the rules that, and what is the organizational culture, the social climate. So it is all very important. So when you're talking about workplace and workplace mental health, so this is how I would like to see it. So when you're talking about successful workplaces, of course, workplaces are rooted in the society. And then we talk about labor market, what kind of labor market that particular society has. And so then we come to, industries, types of industries. And then we come to the organizations or workplaces where we work, the working conditions and the, so the quality of work and health. So this organization, working condition and quality of work and health are important and to be considered if you want to make our workplaces, kind of successful and attractive. So how the work should be organized so that it becomes beneficial to the society, to the company and the individual. And of course, all of us are here, sitting here, all of us work, and we know that when you are in any organization you are working, there are conflicts of interests, there will be ego clashes, there will be injustice, perceived injustice and fairness, there will be risks, and there will be differences in how the benefits are distributed. So it is the role of the, kind of workplace is the area which needs to take care of all these and see that it is, employees feel and perceive that there is some kind of justice and fairness and conflict resolution mechanisms at the workplace. So different societies and different industries work different ways. So as Professor Patra was talking about, I have worked with elder care sector, IT sector, manufacturing, education and health. So IT sector, when I'm talking about IT sector, they may have different sets of problems at the workplace. And when I went to elder care sector, the work is very different. It is always, the work is seen as dirty work in Indian context, because when you are taking care of elderly, so and it is always, it is a gendered workplace. So generally always preferred by, they will pick up, we asked elderly people that whom they would prefer as their caregivers. They said women, because by all over the world, women are the nurturers and they should be taken, whereas they are equally harassed and exploited and misbehaved by the family members. And it's seen as, dirty work and derogatory, associations with elder work. So whereas manufacturing sector will have a different, what I'm trying to tell you is that there are different contexts of different types of industries and sectors. And the problems, the factors which may lead to mental health problems can be very different. So when we are talking about promoting and, promoting mental health and preventing mental health problems at workplaces, you have to be context sensitive. You have to be sector sensitive. You have to look at the industries and societal context very carefully. So this is, kind of when we started talking about the attractive work, this is, one of the project that where we have worked with the organization and values, and we asked people that what makes the organization attractive, or what kind of workplace you would like to work with. We work with gender equality, opportunity for to balance work and family, perceived justice, corporate social responsibility, psychological safety, safe environment, and our findings resonated with the findings from Randstad and Universum, which are two worldwide huge consultant companies which identify the best employers, what employers look in employees and what employees look in employers when they find out workplaces. So these are, so when in India also, you'll be very happy to know that before 10 years, when people were asked that how you will decide to go to a workplace, what determines that? Most of the Indian parents and even the people who will go to, our potential employees will say that salary, security. But today, last 3, 4, 5 years, Randstad report says that they will say that work-life balance, if it gives us enough opportunity to have a break, and whether it has got flexi time and all those kinds of things. And of course, safety, not security, job security. So, so the world is changing fast, globally as well as in India, and we have to look at that what values we are offering to our employees to make them feel safe and to stay there, to retain the employees, to feel, kind of committed to the organization and to enhances the stability. all of us know that in organizations, uh, if employees are hopping on and hopping off, it is a huge cost to the company, because it invests in the training of the employees. And if you are not able to retain them, if the attrition rate is very high, it's a cost not to the company only, also to the nation's well-being, because you are a lot of wealth goes into this kind of thing. So organizations should try to retain their employees and to look after their well-being well, so that their mental health and well-being is taken care of. So when you are talking about a healthy workplace, we understood that employees' health and well-being are that enhances organizational performance. And if people are not feeling well, or are not happy, organizations make happy employees make happy organizations or productive organizations, and unhappy employees make ineffective organizations. So how we would make healthy workplace? How would support psychological health at the workplaces? So there are 4 things that we need to talk about. We have to know the impact of mental health on different things. The second thing is break the silence. Both Professor Suhas Seth Gopkar and Professor Swati talked about the stigma attached to mental health problems. So in organizations, in daily life, at workplaces, people don't talk about if they're not feeling well. We don't have a stress leave in India. So in Australia, they have worked so much on the, they have stress barometer, they have stress leave. In Sweden, the Scandinavian countries, they have stress leave. We don't have stress leave in India. So maybe, I guess, I have not done any research as of now, maybe the presenteeism is very high. People are not feeling mentally healthy and they are extremely stressed, but they come to work. They do not produce, but being there is kind of a, it adds further to the mental unwellness. So breaking the silence or breaking the stigma is important. Provide robust career support, how we can support the employees to have better mental health. And we have to build an organizational culture of well-being, being sensitive. And so what is the impact? Know the impact. Secondary traumatic stress and burnout impact employee health, productivity, and retention. We saw that, of course, 2008-9 has been very old now. That was the old recession. But after that, also recently we saw in 2020, I mean, during COVID time and just prior to that, we saw a lot of laying off in the organizations. Huge pharmaceuticals, huge manufacturing companies. Google recently, to be for 2 years or 1.5 years. So there was huge laying off of employees from organizations. So what happens? So in Baroda, my house is opposite to Sun Pharmaceuticals, where so most of the Sun Pharma employees stay close by. So Sun Pharma, when took over Ranbaxy, when there was a merger, so it also, there was a lot of laying off. So when so what happens in the pharmaceuticals or chemical companies that teams work together. So the team head and a lot of people are working with the team. So they laid off some of the senior scientists from the team. And when that happened, so they said that you don't have to come to the organization, to the office. We'll give you 3 months salary. We'll send it to your account for 3 months. So in 3 months, you can find out things. So why? Why they were not asked to come to the office? They said that we are sitting at home. If you are paying us salary, we can come. No, that is what creates secondary traumatic stress and burnout. So the whole team, it just pulls down the moral of the team so much that when the team leader or somebody from your team has been laid off, so it creates a lot of insecurity amongst the team members, amongst your colleagues. It creates traumatic stress, which is secondary. You have not been laid off, but somebody else has been laid off. But you vicariously learn the feel the stress, experience the stress that the person is going on, and you feel very insecure. You feel very anxious about your own job. So that is something also happens extensively at workplaces, and it impacts employees' health and productivity to a great extent. And people start, then what happens? Other people also start for looking jobs elsewhere, because they say that today it's A, tomorrow it's will be B, and then the C. So why not let me start early and look for other job? Let me move to other companies. So that affects the attrition rate goes up. The intention to leave the company becomes bigger, and the organization finally, kind of faces a setback. So that's why it is so important that what your employees are going through, and to understand that what it impacts. It impacts the health of the employee productivity and the attrition of the organizations. So secondary traumatic stress is emotional distress that arises, that's how it is defined, when someone vicariously experiences the traumatic experiences of another individual. Okay, so what happens that can even create very real symptoms, kind of when you are talking about care organizations, if we forget about manufacturing and IT. So there also when you, kind of people who are in the caregiving job, like the healthcare sector, in the elder care sector, and all those things, you experience others' pain, and that creates, makes you unhealthy. So caregiver burden is a huge thing that is being talked about in care sector, because when they provide care to others, who takes care of them? So these care workers, and that's what we realized during COVID a lot. So how it affected the mental health of the people who were working in care professions, when they look around and feel the kind of pain of others, and so they go through depression. There have been plethora of studies in the field of Alzheimer's, Parkinson, and things where the caregivers, they go through, they so we may have negativity bias. We have, we are anxious, we are depressed, we are overwhelmed, we are angry, we are worried. All these things happen when we go through these kind of trauma, stress, and secondary stress. And what happens then? It results in how it affects the workplace. It results in reduced collaboration. You don't feel like talking to your colleagues. You don't feel like, taking the initiative to interact with people. You withdraw from your, kind of being a part to any kind of activities at the workplace. There is a lot of mistrust. There is, it gives rise to a climate of mistrust at the organization. You can't trust anybody. You cannot, kind of, and it leads to irritability and avoidance of colleagues. We did a small study on, during the COVID, this online and offline work and all those things. And people who were working online, it was in the between the first phase and the second phase. So they said that what we miss most is that interacting with our colleagues, face-to-face communication. So that has affected our productivity, and that is the most important factor. So they said that online meetings and everything is fine, but not because of anything particularly work related, but interacting with colleagues, being with colleagues, meeting them face to face, sitting together, being at the that workspace gives us a lot of it motivates us for work, and that has affected our productivity a lot. So it's very important workplace when we are spending 8 hours here, there has to be a climate of trust, cooperation, collaboration, and we cannot avoid and withdraw from our workplaces. It affects the productivity of the workplace. The second thing after this secondary traumatic stress, what affects the workplace is burnout. Burnout comes from workplace stress, and it is, it's a syndrome. So burnout actually leads to workplace alienation. So what is workplace alienation? Rabi Kanungo is the founder of the term workplace alienation. So like we say, motivation, it is alienation. You come to work, but you are so exhausted. You are not, you are not engaged with your work. You don't want to work. So your productivity goes down. So burnout, burnout has got these impacts. So as you see that exhaustion, cynical feelings about the job, lower productivity. So many of the people who are in their late cross mid career or towards retirement may sometimes feel burnout. And in a study done, in a research done in on academicians, shown that people who are in the age range of 45 onwards, sometimes that group feels a lot of burnout because of, and even the doctors who have worked for 20 years, they feel the burnout most. So what it impacts, apart from other things, it affects the productivity, it affects the employee retention, things like that. And what are the causes? The causes are seen as unfair treatment at the workplace, unmanaged workload. So workload is always a concern, role clarity, and lack of communication. So role clarity, what is role clarity? I mean, there is a role stress major where it talks about a lot of aspects, and one of it is very important where it says that role centrality. So many times, although you are getting a good package, compensation package, and you are very well paid, but if you feel that you are not contributing enough to the organization's growth, or you are just peripheral to the organization, that also creates a lot of stress. You may have a wonderful designation, you have a very hefty pay packet, but you feel that okay, I mean, what am I doing? Am I central to the organization's functioning or not? So the role stress also can create a lot of burnout for the people, and if there is no role clarity, and there can be time pressure. So impact of burnout, I wanted to show this because I will talk about a very, kind of not a new term though. So these are the mental impacts like secondary stress, depression, anxiety, hopelessness, and everything. What it raises in absenteeism and presenteeism, job dissatisfaction, and reduced productivity. So presenteeism is one. Today, I would like to tell you what it is, and all of us, because people who are absent, we can't do anything about. Who are present but not productive, we have to look after them. So that is what is our concern is. So presenteeism was given, the term was given by Gunnar Aransson from Stockholm University, and it has been later on carried out by many people, and a lot of research have been done. So it talks about reduced productivity at work due to health problems. Health includes mental health, of course, that distract one from full productivity. So they come to work, but they are not productive. This is an article with Harvard Business Review, a little old though, 2004 article, but which said that, kind of presentism, they are on job because they are having illness or certain mental conditions, medical conditions, they do not produce, and they are nearly, kind of this problem is nearly invisible. But what has been realized that it cost a lot. This is a 2021 study from NUS Singapore. Duke and NUS both collaborated to do this study and said that the presentism costs a lot more than absenteeism. So presentism, absenteeism, it is almost, kind of 5 to 6 times more than absenteeism. The organization suffers this cost because we are not taking care of the mental health of employees, and it is invisible to us. So here are some interesting pictures. Okay. So today's generation, like Sebastian from Ernst & Young, that's how tired they are. Okay. So this is a study which reports, a global study, which reports that 83% of employees report that despite of being unwell, mentally or physical, they report to work. So the day man-hour wise, it is a great loss to the organization, and it is also affects other mental health. So absenteeism, no, you can, kind of, you can check, but this is invisible. And you can also the magnitude of illness, how many days, what is the medical condition, how much it hinders performance cannot be assessed because the person is coming to the organization as such. So presentism is like this. Absenteeism is just the tip of the iceberg, and presentism is huge, which affects organization, and it's a silent killer in the organization in terms of, it kills all the man hours and not productivity. So you have to be very careful about that. See? This is interesting. So going to, okay. So why there is presentism? Because these are the factors: job insecurity, job stress, overcommitment to work, financial problems, individual boundarylessness, and time pressure. So yeah, so you are unwell, but still you want to pay your medical bills, so you can't leave the job, but you are not helping neither the organization nor the society. So what you do as an organization, what we should do as an organization, we have to acknowledge that presentism exists. And you should also know that how it is affecting the performance of your employees. And it is advised that we should have a policy on presentism. So as I was sharing with you, many countries in the world now have stress leave. Although you do not have a medical problem, still if you are not feeling mentally healthy, you still can take a leave and stay at home. You have to cure yourself, because healthy organizations should believe strongly that their employees are coming healthy to the organization to work, and unhealthy employees being in presentism there, and it affects the productivity and effectiveness of the organization. This is the status of, kind of mental health and presentism in the organization. So this is how we are silent. So telling somebody that I am not well, I am feeling depressed, oh, I am anxious, oh, I am so stressed, is so much stigmatized. Although you are drowned and going to dry, die, but still somebody asks, we said that, okay, we are fine. So we have to struggle hard to break the stigma, to tell people that, yes, it is okay to be not okay. It is okay to be not okay. So that has to be the policy. That is something that should be inculcated in the organizational culture. So break the silence. So you, as organizations, we should conduct the employee awareness programs about depression and anxiety. Many organizations, L&T is one of the very, I really appreciate they are very, not only that they are meritocratic, but they have employee assistance center. Many of the organizations, they have in-house employee assistance centers and they employ counselors, psychological counselors for behavioral problems in the organization. Because, sometimes it so happens that we do not have a place to go, whom to speak to. So it is very important that as organizations, we should have somebody to speak to and should have some counselor, and to convince employees that it is okay to feel stressed and not mentally well. So the more tougher we go, the more hard it becomes. So if we are going to be punitive and take disciplinary actions to reduce the control of absenteeism, we have to be more sensitive to look at the loss we are incurring because of presenteeism, and maybe we can think of giving sick leave and paid time off. There are certain, Tata has been a very good employer, I guess, and, and many other organizations as well. What they do is that they say that 5 days, Tata's principle is that 5 days, all your internet, all your, laptop, nothing will work. So you cannot work at all. You have to go on, leave for those days. And every half an hour, it will blink, blink, blink and say, refresh your, you have to close your eyes, blink and open your eyes. There are policies of extended leave. So if you are on leave and you want to extend it, many organizations give extended leave. So organizations are also trying hard to do that, and we have to learn those best practices from them. That how to make the, sometimes we ourselves become workaholic and it affects our mental health and we are burnt out. So we have to be sensitive to that. And mentoring and counseling, give me the time.
Yeah.
I have now. Yeah. Okay. So mentoring program, mentor-mentee programs should be introduced in all the organizations because juniors, when actually it is on the paper always that it is on the paper. Even we have in our university, we have a mentor-mentee program because we have to show somebody. But there has to be actually mentee program because the career path, the development, the culture, introduction to the organization culture to make them comfortable with the organization can only happen when there is a mentoring program. So it will again reduce a lot the mental health problems of employees and particularly junior employees. So it is a responsibility of the senior colleagues of the organization to offer their time and help to the junior colleagues to mentor them, to coach them, to give them the, impart them the skill which make them successful at the particular organization. This is from Maureen Dollard. She has been working with Cooper. Cooper gave the concept of stress coping. And she has been working for years and years together. And she has been, she is with now Adelaide University. Earlier she was with South Australian University. So their work, the Australian government now has accepted this stress level and uses stress barometer for measuring the safety climate, psychosocial safety climate in the organization. Where it is important that we talk about the, what is the job demand on the employees, what are the resources, support systems available, and it leads to the psychological health and kind of how it promotes health among people. And people should feel safe within the organization if this model, and I mean, you can look at the variables that she's talking about, it is kind of promotes psychological safety climate, and ultimately it leads to more productivity. So why I have put it here is that we should have something like stress barometer. We should have some assessment. There are so many screening tools. Many organizations, particularly the corporate sector, gives makes it mandatory for all the employees to go on a health checkup every year, physical health checkup. Why not a mental health checkup? Physical health is detrimental and not mental health. So, and it is so easy. You can do it. You call a behavioral scientist, do a screening throughout your organization for all the employees to look at what are the risk factors for the employees. Okay, that will give you so much of precaution against mental health issues amongst employees. Okay, so that is what we should, training, coaching, and mentoring should be promoted in the organization, as I have been talking about you. And these are again, I have taken it from the kind of WHO documents. So they talk about prevention of mental health problems, promotion and protection and promotion of mental health, and creating an enabling environment. Creating an enabling environment in the organization will give a lot of support to the employees to break the silence, to reduce the discrimination, and to integrate them well into the organizational culture. And it has suggested different intervention, how you can do it. So you can look at all these documents at the website of WHO for this year's Mental Health Day. And these are wonderful documents, very well structured and, kind of research based. It's too small to look at it from this far, but well, it says that what kind of problems can be helped by what kind of intervention. So supposedly when we are talking about, let me give you an example of, I said that every organization should take exit interviews. Organizations do exit interviews. I am not saying that they do not do exit interviews, but who takes the exit interviews? The HR of the organization and the head of the department. If that is so, do you think that the employees will come up with the real problem why they are leaving the organization? No. So some of the organizations who invite external experts like the behavioral scientists, who is external to the organization for exit interviews, that helps a lot to the organization to identify what are the problems creating, people to leave. I was doing exit interviews for a government organization for a long period of time. I still remember a very young colleague. So they go for campus recruitments and recruit all these young engineers from different campuses, IITs, BIT, WITS Institute, and also NITs and all these places. So this boy who was 22 to 23 years old, he started crying, saying that every day I come to work, my supervisor, the person to whom he reports to, will say that you are useless, you are good for nothing. Said, madam, every day when in the morning you hear that I am useless and I am good for nothing, I started questioning my existence. It created so much of existential problem for me. I wanted to commit suicide. I didn't come to the office for 15 days. I was on leave because it was such a blow to my self-concept. And I am from BITS Pilani. I am such a good student. And if I am so good for nothing, how I could do so well? That's exactly what happened with Anna Sebastian. So people, we never realize that when as psychologists, both of them, my psychology colleagues will agree with me that when you label people, we never realize that how harmful and how detrimental it is for the person's existence. So when you do such things, you can never even think of that can lead to suicidal problems amongst the employees. It can give suicidal ideation. It can break their self-concept completely, self-esteem. So they cannot, how they will expect them to be productive? Support system. So open door policy. Many of the organizations, the HR has become now, there are papers from Arup Burma and Pawan, something who are with Harvard, Arup Burma is, they have worked in Indian organizations and they said that HR has become high tech, but low touch. High tech, low touch. So technically we are now so advanced, but we don't have that human touch with the employees. HR's main job is to be in touch with the employees' real problems. So grievance handling, HR functioning, so all these things, be sensitive to the employees. That is, so you can look at the different types of interventions suggested by the WHO for different situations in the organization and how it can help mental health prevention. They talk about these 4 criteria that integration of employees to the organizational environment and involvement, commitment, participation of the employees regularly, and empowering them. And compliance with the human rights and laws. So there are several policies at the organizational level to protect the rights of the employees. But are they doing that? Is it equitable? Is it gender equal? Is it, employee friendly? So are they complying with the rules? So those things have to be looked at if you really want to, protect their mental health. And this is the last thing. So it is not the organizations only, it is our responsibility as well. So when we are talking about employers, we need better leaders. We have to do sensitive training for the leaders, and we have to talk about the organization as a whole. But civil society also should, take a step to support the organization. Organizations do not grow in vacuum. So the societal society where it is it can put a lot of pressure, kind of soft power it can exert to bring in the, kind of changes in the rules. Look at CSR. CSR, February 2014, CSR became mandatory and there was a lot of resentment towards it. Today, we have done so much through CSR, so much of well-being nationwide because of that. So we have to, kind of look at the stakeholders' engagement also, not only at the organizational level, but otherwise. And healthcare planners, NGOs, civil service organizations can also, they can support the organizations in providing the health impact. And I think that's what, it's not going any further. I think that should be the, that's all for today. And I am open to any kind of clarification or questions or doubts you have. So I'm happy to interact with you all. Thank you very much for giving this opportunity.
Thank you, Professor Biswas, for elaborating at such great length about the different issues that are faced at the workplace, and also highlighting the different measures that can be taken by different stakeholders to actually prevent mental health issues as well as promote mental health of all the employees at the workplace. Okay, because when we ensure good mental health at the workplace, that can lead to thriving of the individual as well as the organization. Okay. So we really thank you for that. And I would just take, I think we can take a few queries, questions.
Professor
and
Alka wanted
observations
to
here.
ask something.
Now, many people in the past have also presented on thanks, but some very good points emerged from your presentation. theoretically, it just sounds very good, but when you try to translate it to action at an organization level, then things become a little difficult. So I think what you pointed out about the assessment of employees, the psychological assessment of employees is very important. We get our blood tests done almost every 6 months, but there is nothing, no way to gauge our mental state. I could also going through something which I do not know, but a psychologist will be able to tell me, counselor will be able to tell me. So I think that really needs to be introduced at the organ. That is just not being done anywhere. Some schools have counselors, some private sector has counselors coming every 6 months to talk to employees and all that. But I'm sure you have a scientific way of assessing employees. So if that can be introduced everywhere, especially in the I think that was very good. Stress leave was also a very good point. So I was just basically thinking that, what happens is that when we hear about suicides, we think that it is like a one-off thing. You know very well that it is never a one-off thing. It is always a cumulative. You see, lots of people join organization, work stress applies to almost everybody. So why is it that some of them, the fragile ones, will definitely give up? So they end up becoming suicidal and all that. But there is a cumulative stress over a time which even the parents hide it when it comes to suicide. They also never reveal it. Because if you have parental support, organization support of your friends, then it is not very easy to end your life like that. So, these are individual cases. So what you said, the best thing in your presentation, I think, when you said that in the beginning only an orientation training needs to be done, because that orientation training would introduce the employees to the organization they're entering and the demands of that organization, the stress levels they're going to face. And also in that, they can also recognize the fragile ones. That individual scanning would tell them right from the very beginning that A, B, C need individual attention and may not be able to deal with the stress. So I think if that is that and impact, our psychological tests can be done, then organizations can do much better. We also have cases in our school and in the university, people who have sort of, I would say, isolated themselves. They could be going through some problems. But we want to help also. There is a lot of entities I can talk about our school. It's very, very sensitive to such people. And our director especially has been very sensitive. So, we know that they need help. But as a lay person, I do not know how to help. And professional intervention is needed, but those people show so much of resistance. And I'm telling you, those people are not here today. So whenever we have such talks, we have our Aahvat Kare and many initiatives, all of us who want to change or who are receptive will definitely join, but people who actually need psychological interventions, they never join. So there is no way we can mainstream these people. So the resistance now comes from them, and then we are also helpless in many ways. So I'm saying that the framework sounds so beautiful here, but it has lots of limitations if you want to put it on the floor. It is very difficult. Thank you.
Oh, yeah.
Still we learned a lot.
I'll just respond to your last concern. Actually, I'm taking it from the this understanding attractive work project that we did. So we learned a lot from that thing. We did it on 88 organizations in Sweden and India and all in 4 sectors. And all. So one thing we learned is that, as you are saying, a lot of resistance. So many things like we have to break the silence. When I said you have to break the silence, it has to come from to the policy level. So once, if you are having kind of meetings, and how often you talk about mental health in the meetings, ask yourself. If you start talking about that, that starts seeping into the mind of the people. That is one thing. And then the second thing that we realized, this we did in terms of gender equality and work-life balance opportunity. So when there are formal meetings, when it comes to the policy and communication, policy communication, like your inter-organization web, which intra-web, inter-web. So do you write when you talk about the policy that this is the policy that we have? So that has to be coming through the policy framework, formal communication, discussion in the meetings. So that will create the culture, enabling environment. So when people who are actually having problem, they're not coming up because it is not welcome. When they know that it is the organization now talks about it, is really concerned about it, it is a part of the policy. It shows up on our web, that gives them the confidence that now we can talk about it. It is accepted. It is fine. So that is one way you can break the silence. You can, kind of that resistance and everything. That I mean, that's what we have learned, and it worked well also. Some of the organizations do it about gender equality, so that that organization employees also feel more gender equal. So I think that.
Basic practices. I think the government sector has to follow.
Yeah.
Not so much. The government sector.
I know the cascading effect is actually works here. I think we can take an online
One, RC
participant.
Trivandrum, and
RC
then
Trivandrum.
Professor Yantan
Yeah.
also wants to ask.
Yeah.
Can we unmute RC Trivandrum, please?
This is our regional center. So from Trivandrum.
Good afternoon, ma'am. Thank you for that very wonderful presentation. It was indeed an eye-opener for many of us regarding a large number of issues at hand. In fact, I have two queries which I would like to which I would like you to respond, ma'am. One is regarding in a normal workplace, there are issues related to mapping of workload. In fact, across similar sectors, across similar agencies, across similar units, the workload is not uniform, or it is not properly mapped even in many of the organizations, resulting in a kind of burnout, or even a kind of alienation from the kind of work that many employees are doing. So do we have any studies in this regard wherein the impact of non-proper assignment of workload has had an impact on the learners as such, on the employees as such? The second one I would like you to respond is regarding the kind of impact of situational factors on employees. Now, very often we find that there are situational factors which force employees to be conformist to certain informal norms or informal kind of patterns. And certain employees who really go against these, who may not in fact conform to these informal norms, may in fact experience burnout or alienation. I feel there are many studies, including that of Zimbardo, the prison experiment, which in fact highlighted the importance of situational factors. Do we have actual studies in the field of organizations where situational factors have in fact led to burnouts or other such issues? I would like you to respond to these two queries, ma'am. Thank you.
Thank you very much for your queries. Yes, there are a lot of studies. There are two things that happens. Two things we talk about in the organization. One is OCB, organization citizenship behavior, and CWB, that is counterproductive work behavior. So many times, normatively, as you were saying, that there are norms that how people should work, although it is not a part of the regular workload. Am I correct? That's what is a concern.
In fact, basically, though the rules may say certain things, there may be over a period of time certain informal norms which come into existence, which to which employees or people working in an organization may be expected to conform to, and these may not be properly put in the form of rules as such. But maybe, for example, in the case that you are referring to, like the case of that lady from Kerala who was expected to work beyond office hours, but those may not actually be part of the rule position. The rules may say that you are supposed to work till 6 o'clock, but the lady may be forced to work informally or beyond office hours as such. So these may be conventions which may come as part of the organization over a period of time. So do we have studies which go through these kinds of informal norms which come in, ma'am? That was my query.
Not exactly on this, but yes, there are studies like what could help here is that there have been studies where there are laying offs going on. So in one organization, the CEO explained the people why there has to be a laying off. In that organization, only 21% of the people feel dissatisfied. I am forgetting the name of the person. I can give it to Professor Swati later. Only 21% feel dissatisfied because of the laying off. Job dissatisfaction was there. In another organization, there was no explanation given to the employees and there was laying off where 75% of the employees was highly anxious and dissatisfied about the situation. So organization where it is a norm to work for more hours, like I was talking about Deloitte and all. So if there is a connection between the top management, middle management, and the employees are convinced why this is the norm that they have to work extra hours and how they will be benefited. And it is always the intention of the organization. The employees should feel that it is the organization wishes them well. It is organization doesn't want to harm them. So the intention that matters, and if that can be convinced, that can be conveyed to the employees, youngsters, they are ready to work for 16 hours, 17 hours. But how sensitive you are to their needs, that also matters. So that sensitization has to be there. Kind of that has to be there. And there are a lot of studies are being done now, have been initiated on this. I talked about this unnecessary and unreasonable work, illegitimate task. So illegitimate tasks can always be avoided. So the organization should have the policy to see that what is legitimate workload, what is illegitimate workload. If some work that somebody else has the competence to do and she can do it better, why that should be allocated to me who doesn't have the competence and I'm already overloaded. So that decision will come from the organization and the top management to make the life easier for the employees.
Thank you, ma'am. Thank you so much. And a special thanks to the discipline of psychology for convening this very topical and very important session. Thank you.
Professor Yanathan, please ask you.
First of all, maybe thanks to the group and special thanks to the for I have a few questions and something to supplement what first of all, we agree that it is okay not to be okay. But unfortunately, we are living in a society where it is not okay to be not okay. You got it, right? It is maybe because of the conditioning of the society conditioning. Because for a very long time, mental health was never good at it. Even now as well. Mental health is not taken. It's a very good thing. I think all of us are still struggling with that. When we come across somebody who is having some mental health issue, I think because of that conditioning of the way we have been brought up, we also do not look with positivity. Even though we may have a concern that yet we already have a negative conceived mind of looking at mental health. But the reality is that, like we all go through different health issues. Sometimes it could be just a fever, viral, it could be something related to stomach issues, something related to headache, and cancer, and so on and so forth. Some of these ailments are seasonal, and we just get it over. And some, if it is not given a proper treatment, then it prolongs, and then that's how we end up dying. And likewise, I think it is also the same with all of us. We don't have a stable mental stability state of health. Sometimes certain small issues can trigger us, and we may get into any other mental health issue, which is possible that we can overcome within a few days or week. But there are certain mental health issues that we encounter in our daily life, which may trigger us and we may not be able to get out of it, right? And we live in a society where we are looking at mental health, which is associated with love, you know? And so in your lecture, I see a very good way forward that you have mentioned. Of all the things that you have mentioned, I think I like the way forward things you have mentioned about coming up with a implementation of policy. Because once these policies are there, it will enable us to empower that, yeah, it is possible that we may all go through such kind of issues, and it may help us to overcome our negative attitude towards mental health. So I really like that the way forward that you have mentioned. Okay, another point I want to mention, and I don't know whether it can be received in a positive or negative, but this is just out of curiosity. In the discussion, it just came to my mind. Well, many studies suggest that women are more prone to mental health.
Depression, not mental health.
So depression is not a mental health.
Depression is a part of mental. There are different categories of mental health.
So anyway, I may be wrong, but so just correct me. Yeah. So if women are prone to such kind of things, and they get married, and so what is the chances of the mother passing down to the children and the family? And then it will come down to the society. So this is just.
Yeah,
That's why I would say it.
The hereditary factors.
Some psychological disorders are genetic, not necessarily all. But of course, I mean, it is equally, if father is having depression, I suppose, definitely that is also going to have impact on the child.
Yeah, I think.
I think I will let the result.
Shall we let-
Like, I'm not talking about genetic, that's percentage can be less, but I think all of us, every human being has a chance of having a mental health, maybe economy, like the office environment, example, maybe our society where we are living, the climate environment, and all these issues can take us to mental health issues. So hereditaries are also there. There are certain people, and the hereditary also came up because that particular family had gone through many years back, and so over the years it passed down, and that's why it also became hereditary. And the world that we are living today is such that it is information overloading and so much competitive. Forget about office, but everywhere, And so we are living in an environment where it is not okay to be, it's not okay to be not okay.
Shall I respond to your
Yeah.
questions now?
Sorry, I took a long time.
Yes, no, it's fine, absolutely fine. I'm very happy that you raised these questions. The first thing is that there are, as both of them, Professor Suhas and Professor Swati talked about, there are diagnosed psychiatric disorders which are of serious nature, which has got a genetic link, which may be transferred. But depression, anxiety, there are several other things like you have, They happen to everybody maybe, and all of us are susceptible to that. And that can be done if we can first diagnose it early, or you can rate it early. Depression, if I am depressed today, that is my mood. I am not, it is not a clinical disorder.
Yes.
So you have to, it has to be diagnosed as a clinical disorder to be treated. And it can be, it is treatable. That is one thing. The second thing is that when you are talking about genetic and all those things, all of us know about nature nurture thing. So somebody who has got very healthy genes from the parents can also is susceptible to mental health problems if he has got different types of stress and environmental stress, psychosocial stress and things like that. So it can happen to anybody. It is not that if the mother had depression, the child will have depression, and the father had depression. It is, as we know, that it is not true. It is curable, and it can be cured through counseling only. The many of the things can be solved if it is, it can be prevented to lead to clinical disorders. When we say that more than 3 months you are depressed, then it can be diagnosed as a disorder, but not before that. So it can be treated like that. Second thing, what you were talking about, the stigma, actually COVID, I always say this, please, if you don't agree, you can always forgive me. COVID has done a lot of good to psychology as a profession. So now all over the world, people have become so much sensitized to mental health and that how mental health problems can come up, that the stigma has started melting away. So now many people, many places, if you look at the internet, even the online counseling and diagnosis and things like that, people have really opened up to consult a psychologist for this. It will go forward, it will it is going in the right direction, that youngsters nowadays, they go to the counselors, maybe people who are in my age or 10 years younger than me, they have little hesitancy. But youngsters, they are quite open to see a psychologist for all these kind of issues, relationship problems. Even parents about child rearing, how they will rear the child in the right way. So that way we are now ready to support people, and it is not like cancer or something that somebody will die if it is not treated in the time. So it is just a continuum. They will tell you, talk to you later on. So it will.
I think we can take one last question. Yeah.
Even RC Vijayawada, I would like to ask one question.
A lot of people working in the private sector who experience this phenomenon beyond all. I mean, when we talk about this phenomenon, not to talk about something called social safety net. We could include counseling and psychological support. What people when they experience this phenomenon, and what do you think about?
You are absolutely correct, and I thank you for reminding me. So many organizations, when there is a laying up program, they also, they have a sale where they appoint they either, on a part-time basis or they hire people, psychologists, where they send these people for counseling. So that is a psychological safety net. Thank you very much, sir, for reminding that thing. So you have to have a safety net, create that safety net, social support, and kind of mentors. When people are being laid off, they should avail those kind of safety practices which will prevent them to fall into the mental health problems. Absolutely.
One last question, I think we can take.
Presenteeism.
I would like to elaborate on the concept, and I would like to know that I feel a stream of psychology and evaluation. So I made a project on ancient deficit hyperactivity, ADHD. So I would like to know that most of the stress disorders, including ADHD, are they a product of absenteeism or presenteeism? And is absence
they are different things. They are different concepts. Absenteeism is something when, people have problem and they do not come to the thing, so to the workplace. So they are absent, means they have to on leave and they are not, so that time their productivity is not being counted in terms of man hour for the organization. But if I'm coming to the organization, I am present there, but I am not contributing anything. So my organization is incurring loss because of my presenteeism. So when I am absent, suppose I am on a sick leave, I have taken EL. So it is the cost is getting, deducted from my salary or something. But when I am coming here daily, I'm taking the salary, but I have no contribution. It becomes a huge cost to the organization. And also it creates to you start feeling guilty, you start feeling like what do you call it? You feel that you are somebody who is not respected by your colleagues. It affects, slowly it affects your self-concept, self-esteem, your social relationships. So that contributes to your mental health. Read the book by Gunnar Aransson. Gunnar, G-U-N-N-E-R, Gunnar Aransson. He from Stockholm University. The book's name is Presenteeism. And you can look for some of the research where they talk about the different aspects of presenteeism. So now, Aronson, A-R-O-N. Yeah, this is in a formal setup. जहाँ पे कि formal setup में हम absent होते हैं, present होते हैं, ये इसका so आपका yeah, it is in an organizational context when they're in a work context. Personally, if you are not doing, I'm not motivated, I don't want to work now, I don't have the mood to work now, so that is your personal choice. No. And ADHD, please read about ADHD if you are working. ADHD has, it has got a lot of implications. So be very, you are a researcher, it seems, and I am happy that you raised the question. Please clarify this ADHD concept and its causes and connotations and impacts and all, and the way you are studying it, because it is a huge thing, and ADHD is now amongst us, all of sitting here. Maybe somebody has ADHD goes unnoticed. It is very common when you grow older, it becomes
Not
less
manifested,
visible,
yeah.
manifested, but it can still be there. GAD, general anxiety disorder, has become so commonplace these days, so commonplace. So we have to be very sensitive about all these things. And
Actually, there are, severe mental disorders, as Professor Biswas was telling. Severe mental disorders are there, and then common mental disorders are also there. Like we say, common cold and this thing. So that's how stress, depression, anxiety, these are like common mental disorders. So that we need to be aware of, and then it's a continuum, as you said. Okay, starting from one end where you have the mental disorders which are severe in nature, and then going into the absence of mental disorders, but then you need to go beyond that where we talk about positive mental health. So that is.
Illness to wellness is a continuum.
Yes.
Yeah,
Want
but
to?
like common mental health issues, if we have a regular interaction, like all of us are aware of cold, cough, viral, diabetes, blood pressure, even cancer. And so we are more aware how to handle it. But if we have more workshop, more talks, see, in every school it's an observation with a question. All the schools have those counselors and people are there to help. But they are, I think, only handling to those children who are going to that room. So they are the ones who feel, okay, I need some help. But there must be many who are not going in that room, but who do need help. And probably they are the ones, who later, when they're exposed to the environment, which when they're out of their cocoon, they face these issues.
That is the role of the teacher to, actually the class teacher should identify the students whom she guesses that have.
नहीं ये तो ठीक कह रहे हैं आप, you're right, but then एक इतना खुला environment होना चाहिए कि हम सब मिलके बैठ के वो बात करें, तो उसमें कोई अपने को isolated महसूस नहीं करेगा अपने बारे में बात करने में कि भाई मुझे ये मुश्किल होती है, मुझे होमवर्क करना है, एनीथिंग आई हैव टू गो टू डॉक्टर, मेरा बीपी बढ़ जाता है, ये सब क्या है, बियॉन्ड हो जाना है. So I feel कि अगर हम ज्यादा openly if we talk about our mental health, we are made more aware कि ऐसा होता है. So I think we would have lesser cases because हम हर चीज family पे, organization पे वहाँ policy होनी चाहिए या ये नहीं. I think from within also it has to come,
Individual तो पहला है.
and it can come only when we are able to. We discuss cinema, we discuss politics, why not mental health also? So I feel that we need to open ourselves up and talk about it. Maybe it can help society better.
Yes, yes. That's why.
Yeah, and I think, you know, to some extent, I would like to say post-COVID in School of Social Sciences, we really felt this need. And, you know, we have something called Aao Baat Kare, which is a great initiative. Plus we have excursion. Professor Alka is here, and we do have kind of informal get-togethers, you know, because we decided post-COVID that we need this. So School of Social Sciences has taken that initiative, and not only our, you know, the present employees, but even our super educated employees, we get to interact with them. They also have been wonderful mentors, I can say that. You know, so we do have that informal system also in place. But yes, as ma'am has said, you know, more of such initiatives are required where we try to normalize all these issues, try to understand what is stress. There was a wonderful question in chat, I suppose, about stress. And stress is very much a part of our life and very important part, without which we will not feel motivated. But yes, if it goes beyond the optimal level of that individual, it is going to interfere with his or her day-to-day life. So I think it has been a wonderful discussion, and we take it forward. We have, you know, much more such activities, and, you know, the discipline of psychology, I can say, we are always approachable and open to anyone coming and discussing any issues with us. And hand over to Professor
Yeah.
Swati Patra now.
Definitely, awareness is the key, and then at the same time, the policy level intention also matters a lot for the ensuring mental health and well-being at the workplace. I would just highlight this, that the Ministry of Education recently they have issued draft guidelines regarding identifying the at-risk children in the school setup. That is called it's known as Ummeed. UMMEET. That stands for understand, motivate, manage, empathize, empower, and develop. So these acronyms, if we look into these terms, it highlights that every child matters, okay, and needs to be taken care of. So that these guidelines are for identifying the signs of mental health related issues in the school setup. So on similar line also, each employee in the organization or workplace setting and their health, including mental health, that also matters in the organizational setup. Okay. So I think on this World Mental Health Day, let us commit to building work environments and creating a healthy and happy mental workplace, as our resource person was highlighting. So at the end, I request my colleague, Dr. Neha, to propose a formal vote of thanks.
Thank you, ma'am. Good afternoon, everyone. And I'm here today to, express immense gratitude and privilege to extend, thanks to everyone who has made today's talk meaningful as well as a successful event. First and foremost, I express my deepest gratitude to our chief guest, Professor Urmi Nanda ma'am. And thank you, ma'am, for sparing your valuable time and delivering such an insightful and thought-provoking talk. Your words have not only enlightened us, but also provided valuable perspective on mental health, and that we all need to consider deeply. And though Vice Chancellor Ma'am could not join us today, but thanks to VC Ma'am for her constant guidance and support. And a special thanks to our Director SOSs, Professor Suhas Ma'am, as well as Professor Swati Patra Ma'am. Their guidance have been instrumental definitely in organizing such events. And I also extend my gratitude to COE Director and all the directors and heads of various schools and divisions. Thank you for joining us. And a heartfelt thank you to all the faculty members from various disciplines for your presence and contribution in making this event richer through your engagement. And thank you to our research scholars for joining us, and to all the online participants, those who have joined virtually. Thank you so much for being a part of this meaningful conversation. A big thank you to Horticulture Department for adding beauty and a sense of calm with their beautiful decoration. And a special mention to our research scholar, Yamini, who designed e-poster for this talk. And that poster has, definitely captured the essence of today's talk very well. And a warm thank you to all our SOS staff. And finally, to one and all present here today, thank you for participation and for being part of this important talk. Let us continue the momentum created today and carry forward the message of mental health. Thank you, everyone.
Thank you. Thank you. Thank you, everyone. Thank you to all, and we are ending the meeting here online.
We get ourselves clicked there.
Yes, yes, definitely.
Now,